And one correction on an earlier headline. The Iraqi former Prime Minister Iyad Allawi's bloc is ahead of the current Iraqi Prime Minister Nouri al-Maliki's bloc in early results in last week's elections. And those are some of the headlines. This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman with Anjali Kamat.
Welcome, everyone. The Democrat-led push for health care reform is in its final stages as lawmakers prepare for a congressional vote as early as the weekend. House Speaker Nancy Pelosi says she has a, quote, massive whip operation trying to round up the 216 votes needed for passage. Pelosi is meeting with wavering lawmakers individually and in groups. Meanwhile, President Obama has summoned Congress members to the White House one by one for private face-to-face talks. On Monday, Pelosi suggested she might attempt to use a special legislative procedure to avoid a direct House vote in order to pass the less popular Senate version of the bill. Within the Democratic caucus, opponents of the health care bill range from right-leaning Democrats who want to include harsh anti-abortion measures or who think it's too expensive, as well as progressive Democrats who are insisting on a public option. But now a number of Democrats who have decided to vote for the bill have also signed on to the Public Option Act, a measure that would allow people under 65 to buy into Medicare. The bill, also known as the Medicare You Can Buy Into Act, was introduced on the House floor last week by Florida Congressmember Alan Grayson.
So I'm asking the Speaker and the leadership, if we have to vote on this Senate bill that doesn't have a public option in it, if we have to vote on this reconciliation amendment that doesn't have a public option on it, isn't it time that we finally did something good for America? Isn't it time that we gave all Americans the right to buy into a public plan like this? Isn't it, in fact, past time that we did something like that, and what's the harm? I say to those people on the other side of the aisle, if you don't want to buy into the public option, that's fine, but don't prevent me and my family and the ones who I love from doing the same. Let us have our alternative, and remember what you said so many times before. You say the government can't do anything right. Well, let's see. Let's see right now. Let's let people buy into the public option through this bill, H.R. 4789, and we'll give it a shot. Thank you.
Florida Congressmember Alan Grayson speaking on the House floor last week. His bill has since attracted 50 co-sponsors. Congressmember Grayson joins us now from Washington, D.C. He's a freshman Congressmember, and he's no stranger to controversy. In October, he came under heavy criticism from Republicans after he said on the House floor that the Republicans' health care plan involved wanting people to, quote, die quickly. He also established the website namesofthedead.com, honoring those who've lost their lives because they were uninsured. This past weekend, former Alaska Governor Sarah Palin traveled to Graysons' Florida district and urged voters at a Republican fundraiser to oust Grayson in November. Well, Congressmember Grayson, welcome to Democracy Now!, still speaking to us from the nation's capital. Can you start off by explaining your bill that you've introduced and then where you stand on, well, the whole health care reform bill that is being pushed through now?
Yeah, I've introduced a simple 3.5-page bill that opens up Medicare to anybody who wants it. If you want it and you pay for it, it's yours. It's that simple. It's open to everybody under the age of 65, whether or not you're handicapped, and you pay the same amount as other people your age would pay. And the reason to do this is because we need a public option. We need an option that doesn't involve putting us at the tender mercies of insurance companies, particularly if there's a mandate to do so. A lot of people feel that there is a fundamental conflict of interest between themselves and private insurance companies. The private insurance companies make money by denying you the care that you need to be healthy and sometimes to stay alive. And a lot of people are just sick of it. So the way that to get beyond that is to open up Medicare, which is now available to only 1/8 of the population, to anybody who's willing to pay for it. And it makes perfect sense when you think about it. I mean, we don't say that federal highways are only open to senior citizens. And the Medicare provider network is an enormously valuable, expensive thing that we've created with federal tax dollars that ought to be open to everyone, not just seniors.
And how does this fit into the major piece of legislation that will, or, I don't know, a demon pass, won't be voted on by the House?
My hope was that we would vote not only on the Senate bill, which doesn't have a public option, not only on the reconciliation amendment, which probably will not have a public option, but that we'd also vote on this, that there'd be 3 votes instead of 2 votes. And if we voted on this and we passed it, then it would be presented to the Senate and subject to reconciliation in the Senate so that we could end up with a public option.
Now?
Now.
Right,
and if not,
but now,
then it's something to build for in the future.
And would you support the bill even if your bill doesn't go through?
Well, if you're talking about the Senate bill combined with the reconciliation fix, the answer is yes, because that's a bill that saves lives and saves money. And I feel that to do that, to deny 30 million Americans the insurance that they would have under that bill, the Senate bill with the reconciliation fix, would be cutting your nose to spite my face. So I would be very reluctant to vote against a bill that will end up doing so much good for the Americans who don't have insurance and also help to restrain the growth, the large growth of premiums for those who do, and make insurance manageable for people and establish certain minimum standards. Those are all good things to do. But I think it's a better thing to do to combine all of those things with the public option. We've heard all year long from the Democratic leadership and from the president that we need a public option to provide competition to insurance companies where there is no competition. All over the country, including many places in Florida, we have in markets where insurance companies have 80% of the market if there's only one or two of them. So it's a monopoly or it's an oligopoly for 80% of the market or more. And those insurance companies charge you whatever they want, and they give you whatever little care they can get away with. And that's true all over the country. If Medicare was available to anybody who was willing to pay for it, then in a place where there was an insurance company monopoly, there'd be two choices. In a place where there are two choices already, there'd be three choices. And that's going to be a dramatic improvement.
Congressman Grayson, talk about your own family's experience with health insurance.
Well, in the case of myself, I grew up a very sick child. I went to the hospital 4 times a week for treatment. I went there only because my parents were both union members who had union benefits. Twice, when I was 7 years old, when I was 17 years old, my parents went out on strike. They were worried about how to pay the rent. I was worried about whether I'd still alive, whether I'd still be able to get the health benefits that I needed, the health care that I needed to stay alive. And that's a hard, hard thing for a 7-year-old to be thinking about. When my own children were born, we had private insurance. I have 5 children. When the first one was born, the insurance company told us after the child was born that there were no maternity benefits under the policy, and therefore we had to pay for the birth of the child. I thought I had insurance. I thought it covered it, and it turned out otherwise, so I had to spend $10,000 to cover those bills. Now, you know, it could have been worse. Maybe I wouldn't have had $10,000. A lot of people find themselves in that situation. Medical bills they can't pay for. About 1 million Americans find themselves in that situation every year, and they go broke. It could have been worse in a lot of ways. I had children later on, twins, who were born prematurely. And I don't even know what their medical bills were, but they were covered by insurance. They could have been hundreds of thousands of dollars. I don't know. But I do know that when you're sick or when someone you love is sick, you shouldn't have to be worrying about how you're going to pay the bill. That's the last thing you need to be worrying about.
How, Congressman Grayson, did the House go from saying there'd be no question they would not support a bill without a public option to where it is today? What went wrong?
It's a mystery to me. I thought we should have gone to reconciliation a year ago. I said it publicly. I never thought that you'd be able to get the cooperation of any of the Republicans. The Republicans have just decided that they're against everything, and they somehow think that no is a policy. I don't understand the psychology or the politics of that, but that was their decision a long time ago. It's not as if they kept it a secret. So I knew that we'd get a better bill, and certainly a bill, if we assumed that we could